Hi, everyone. I'm Dr. Aaron Farberg. I'm a board certified dermatologist based in Dallas, Texas. My background's a little different. I did medical school at the University of Michigan, where I stayed there for 3 years in training in plastic surgery and reconstructive surgery. From there, I went and moved up to New York City, where I did a fellowship in skin cancer, followed by another residency in dermatology at the Icahn School of Medicine at Mount Sinai, also in New York. After that, I went down south to Little Rock, Arkansas, where I completed a fellowship in Mohs surgery, a special type of surgery for skin cancer, before moving to Dallas, Texas, where now I'm in private practice, as well as we have our own residency program and research trials as well.
Love to hear it. That I know you have a really diverse background. Can you talk to me specifically about your experience in the past working with patients with skin issues, specifically chronic to severe acne?
Absolutely. So one of the big reasons I switched from plastic surgery into dermatology is because the skin, there's over 3,000 diseases that we actually are able to diagnose, treat, and help patients. So really, the skin is the window into the world. Acne is a very unique disease. It's a chronic disease, meaning it's a disease that we don't have a magic wand that just takes it all away. And so you really have to understand this disease and how it's impacting patients. And then you get the fun job of figuring out what's going to be the best treatment. And that's always something I sit down and I talk with every one of my patients, saying there is over 1,000 treatments just for acne, but we're going to figure out the right one for you. And I may be wrong, and that's okay at first, but it'll be important for us to work together and use a collaborative decision-making process to figure out the best treatment for you.
Talk me through some of the most common treatments that you've been able to see success with your past patients.
Oh, I love that. Because literally, how much time do you have? Let's sit down and really go through it all, because there are topicals, there are pills, and they all work in a variety of different ways. No joke. I sit down with every one of my patients, and first and foremost, I tell them the most important treatment is a good relationship between you and me, or really you and your dermatologist. Because again, we're going to try to figure out the right treatment for you, but we'll always have to sort of make tweaks and make adjustments. And oh, by the way, during your treatment process, you may change your mind, or we may just find that a different treatment option is what's going to work best for you. In other words, I'm not going to know if something is working or not working unless you tell me. Now, back to your question about different treatments. So there's topicals, there's topical antibiotics, which work both to kill bacteria, but they're also anti-inflammatory. There's also hormone-related topicals, and then there's topicals that change the way your skin grows and turns over. Then we move over to pills, and there's a variety of those. There's antibiotics, and again, they'll help decrease the bacteria, but they also help with inflammation. There's also pills that work on the hormone side of things. The one that's very well known is spironolactone. Then we also have Accutane, or Isotretinoin, which again, I told you there's no magic wand, but it kind of almost is like a magic wand. It's really our best treatment option that we have in fighting moderate to severe acne.
So, knowing all of the different treatment types available that are, typically prescribed to your patients and most patients out there when it comes to chronic acne, what are some of the risks associated with some of them that you feel like would be noteworthy?
Oh, every single time I'm sitting down with my patients, we have to discuss the risk and the benefit. There's no question there's always risk coming with everything you do. You got in your car this morning and maybe drove to work. There's risk associated with that. And we really have to understand the risks and the benefits with all the treatment options that we have for treating acne. When it comes to topicals, oftentimes it's irritation, it's tolerability, which reminds me, one of the other very important treatments is having a very good skincare regimen. We can talk about that later. But assuming you have one of those, thinking about these topicals, we have to think about the various levels of irritation. I can have the world's best topical treatment for acne, but if it's too irritating for you to actually use and put on your skin, it's probably not going to be the best because you can't even put it on. Now, thankfully, we have a number of different tips and tricks that we can use to really be able to tolerate these topicals. Then when you get into the various pills, of course, there's a lot of GI upset that we have to be worried about. And with spironolactone, for example, it is a potassium-sparing diuretic. So extremely rare, very rare that it would cause any sort of impact on potassium. But that's one thing I've learned in medicine. You never say never. And so it's always best to be cautious and be sure that, the patient is tolerating everything very well.
As someone who, previously had chronic and very treatment resistant acne, it's funny because a lot of people, my peers included, but also like medical professionals, talk about all these risks associated with more, let's call it severe treatments such as Accutane, but way less about the less severe ones such as spironolactone. So for example, like I had nothing but good results and not very severe side effects when it came to Accutane. But when I took spironolactone, it was very easily prescribed to me. It was like, man, why do I feel so bad? Like, why is nobody talking about these side effects? So that leads me to my next question. Why do you, as a healthcare professional, think that there's so much stigma around Accutane and maybe not so much the other treatments that are widely available as well?
Yeah, that's a challenging question for sure. What is the stigma around Accutane? Well, let's face it head on. There's a boxed warning, and really it's for issues that it can cause a lot of severe birth defects. So you absolutely cannot be on this medication if you're pregnant or even potentially getting pregnant. You don't want to be playing anywhere in and around that game. Now, I'll also take a step back and recognize that there's a number of medications that I, as a dermatologist, or my colleagues in a variety of other fields, prescribe other medications that also produce significant and severe side effects, or I should say, birth defects. Why is this drug drawing so much more attention? Well, it's because it's got that box warning for sure. And it's just the other concerning side effects, anxiety, depression, and suicidal ideation. Of course, that's very serious. We want to take that very seriously. Now, let's take a couple of steps back and think about where this is all coming from. When we think about acne, a lot of people forget to realize that there is a huge psychosocial impact that acne has on these patients. You think about a patient with moderate to severe acne, they're waking up with significant painful skin acne. They don't want to go out and see their friends. They don't want to go out and have any social events. They're feeling terrible about how they look. That can have a very drastic impact on these patients. We know this because we also see it in other disease states. Think psoriasis. You have these big itchy white plaques where you have flaky skin all over. These patients are afraid to go out. Same thing with atopic dermatitis or eczema. These patients are itchy. They're basically scratching themselves all night. Now, does the disease cause the depression, anxiety, or suicidal ideation? We know that there is a correlation, but we haven't really found that causation. We do know that there is a relationship between all of those. And so that's something we just have to face when it comes to acne. We have to take this seriously, and we absolutely do and will. And every dermatologist out there knows about these issues, and we consider them every time we're considering our treatment options for our patients with acne.
What has your past experience been with your past patients through their processes through Accutane?
So my experience in patients that have been prescribed Accutane is actually similar, I believe, to your experience. It goes quite well. And then after the series of treatments, most of my patients are extremely happy with the results. Although sometimes, of course, you have to go through a second round. More than half those patients that otherwise would be reasonable to go through that second dose or second round of Accutane are so happy with the result that they choose not to go forward with it. They're actually happy with their first and one round of Accutane. For the most part, though, patients are happy. It works really well. Again, sometimes there's issues with side effects that we have to really hold the hand of the patient and walk them through those. But again, by and large, the overall experience has been very positive.
I guess, what has their mental health progression been like through Accutane? Could you speak to that?
When it comes to acne, Accutane, and mental health, I take it very seriously. We really have to understand the patient and understand the treatment that we're considering to prescribe, and then weigh that risk benefit. At all times, the benefit has to always outweigh the risk. For the most part, patients progress through their Accutane treatment and they're extremely happy. They have great results. We know it's impacted millions of people in such a positive way. But again, that doesn't diminish the fact that there are adverse events, and we have to consider all of those. And we also have to consider them in the patient. You had a great experience with Accutane, but you had issues with some of the other treatments. Again, it's almost impossible to know which patient is going to respond perfectly to every treatment, which goes back to one of the original things I told you, that the most important thing is having a good relationship with your dermatologist. We'll continue to reevaluate your treatment plan, continue to reevaluate what sort of side effects you're having, and make adjustments that are personal to you.
On an anecdotal level, have you ever had your own personal experience through the struggles of acne or other skin-related diseases?
Growing up, of course, I experienced acne just like I think all the other millions of teenagers out there did as well. And I would consider it moderate to severe. Again, my perspective as a teenager, everything is severe. And that's also why I try to empathize with my patients and really understand what they're going through. And so I went to see a dermatologist when I turned 18. And unfortunately, my experience was a very quick interaction. And I know that's not the normal experience. Most dermatologists really take the time to explain all the treatment options, just like I discussed, and then also evaluate the treatment as you're going through it. But I was given essentially a topical retinoid that I used, and it just became too irritating. Again, we're talking about side effects. The side effect of this adapalene was just too irritating, and I wasn't sure of any tips or tricks to really tolerate it very well. So I did like most teenagers did. I threw the bottle away and I started Googling and trying to figure out, well, what other options are there and what else can I do? And I really tried putting together a hodgepodge of home remedies, different topical treatments, walking up and down the aisles of Walgreens, trying to figure out what might work. It was really, really frustrating for me. And I really could have benefited, I know, some greater understanding and management from my dermatologist.
And it's so interesting to hear that from you, even as a board certified dermatologist with tons of medical experience, that you had the same exact progress and journey that like a regular person like me and probably a lot of other people have had. So man, it's just so, we're all living the same life.
We really are. We're all human. We're all going through this. And again, the goal here is to help as many people as possible find the right treatments. It's personalized medicine. It's personalized care. It's what I lecture on. It's what I'm interested in, trying to find and align treatment goals with patients. It's this collaborative patient-making decision process that is so important to that ultimate goal, which is not necessarily curing a disease or removing a disease, but letting patients live with their disease or live better, live more positively with their disease. And that may be different for every patient. And it definitely doesn't necessarily, I'm not the one that determines that outcome as well.
So Dr. Farberg, do you have any last concluding thoughts that you'd like to impart on our viewers?
Always wear sunscreen.
So true.